Hi, my name is Marcus. I'm now going to deliver an exercise program for an older adult with a managed condition. Today's client is Faye. She's a 60-year-old female with diabetes who has been referred to us by her GP. We have already filled out an adult pre-screening tool for Faye and also filled out a client profile form. We have a referral letter from her GP and we have written out her exercise program. Okay, Faye, what I have here is your referral letter from your GP. What is good for us is that she has given us the clearance for you to do exercise, as we did note some things in your pre-exercise screening, like you have type 2 diabetes and also borderline hyperintensive. With that, there are some guidelines that we have to follow though. And the first thing is whether you have eaten and monitored your blood glucose today. So have you done those things today?
Yes.
You have? That's good. The second is that we're going to make sure that you exercise most days of the week, and we also discussed about being physically active when you can. We won't allow the exercise program to go for longer than 30 minutes. We'll also be doing a moderate intensive cardio resistance session, and part of that session we need to do is to have an extended warm-up and extended cool-down. So we'll be doing that for about 10 to 15 minutes for each. Okay. Also, we won't be doing any isometric contractions, and they're contractions that where you're holding a static position. So we won't be including any of those into the program either. Okay. So what we'll be doing now is doing the warm-up phase. We're looking at bringing your intensity up from around that 40% resting heart rate up to around that 70% exercise heart rate. So we'll be keeping you here for the next 10 to 15 minutes on the resistance. In any stage during the warm-up, if you get any back pain or anything like that, then just cease it there. Okay?
Yep.
Okay, Faye, we're going to move on into the conditioning phase now of the program. We're going to take you through a set of exercises. I'm going to take you through the squats, the wall push-ups, the resistance band row, and the seated dips. We won't be taking you through the crunches today because you did raise that you had a herniated disc in your pre-exercise screening. So we'll be focusing on the other exercises today and bracing your abdomen, and that will help with your lower back issue that you've got. Okay, so the first exercise we're going to look at is the squats today. And I'll just run through it. So at home you could use a chair or anything like that as a guide. So what you need to do is have your feet shoulder width apart, and you want to lower down like you're lowering onto a chair, squat right down. For this exercise though, it's whatever height you feel comfortable with, okay? So you don't actually have to go and sit down on the chair, you can be slightly raised, or if it's a little bit further than that, that's fine, okay? So hands out in front, and you just want to squat down, all the way down, and then all the way up. Making sure you brace your abdomen when you're doing it, and you're keeping that neutral spine. So let's get you to have a go at doing that. If you feel comfortable going all the way down and sitting on it, then that's fine. But certainly, yeah, go to the height that feels comfortable for you. So hands out in front, feet shoulder width apart. That's good. How's that feeling? You feel any pain in your lower back at all?
No, it's fine.
It's fine. And you spin, bracing that abdomen, keeping that neutral spine. That's good. All right. So with that exercise, we'll be looking at doing 15 reps, and you'll be doing 2 sets of those 15 reps. The rest in between is 60 seconds, so that's what we'll be looking at for that. The next exercise we're looking at is the wall push-up. So you can use any wall that's available. So just put this out a little bit. So again, you want your feet shoulder width apart. You want to put your hands shoulders shoulder width, and then just slightly lower than your shoulder height. You want to step back and up onto your toes, sorry, and you just want to come forward and just raise. You don't want to smack into the wall. You want to want to bend those elbows, come in. Cool. You want to brace those abdomens when you're doing it. Making sure you push through your heels when you do it. Actually, I might just move this slightly further out. Alright, step back. Hands just below shoulder height, shoulder width apart, up on your hip, up on your toes. Just going to come forward. That's it. Keep embracing your abdomen, keeping that neutral spine. There's no pain or anything in your lower back?
No.
Or anywhere? Okay, that's good. Alright, so again, we'll be looking at doing 15 reps and 2 sets of those 15 with 60 seconds rest in between. Okay, so what we'll move on now is to the resistance band row. And what we've got here is any band you can buy from the sports store. They do realise they do come in different colours, and different colours mean different strengths. Alright, so if you buy one, it might be too hard resistance for you, too strong for you. But certainly if you buy one and can't feel the resistance, what you can do is fold it in half, and then you get the double, might be big resistance for you. Cool. So you just you can wrap it around anything at home, even if you've got like a table of a chair, or the table, like the leg of the table or the chair that's sturdy enough, you can wrap it around there and certainly do it at home. So you want your feet shoulder width apart, slightly bending your knees. You want to brace your abdomen, and you want to hold on to both ends of the band. Neutral spine, shoulders nice and relaxed, and you just want to stretch all the way back, and then bring it all the way forward. You want to stretch as far as you can, get that stretch right in the back, and then bring it forward. If you need to stretch, walk out a little bit further. If it's feeling a bit too loose, like you just want to stretch. Cool. So I'll get you to have a go. So feet shoulder width apart, slight bend in your knees. Locking your elbows. Brace your abdomen. You just want to stretch all the way back. That's it. And all the way forward. How's that feeling for you? There's no pain in your lower back, in your knees. Cool. Just give me a couple more of those. Excellent. One more. Good work. Just leave that there. Okay, so with the resistance band row, you want that 60% intensity, and we're looking at 2 lots of 15 reps, 2 sets with 60 seconds between. Okay, so we move on to the last one, which is the seated dips. So I'll just set this back up for you quickly. And again, you can use a chair at home. So we've just got that there. And what you want to do is have your hands facing that way. You want to step out so your legs become almost 90 degrees. And you just want to lower down, all the way down, and then all the way up. You want to make sure with this exercise though, if you've had any, got any shoulder injuries or past dislocations, not to do this exercise, because it may inflame that injury or cause that injury. So just be wary of that. You want to come all the way down and all the way up. With this exercise, the closer your feet are, the easier it is. So if you are finding it too easy, you can just put your feet out a bit further, and it becomes a lot harder to do when you're dropping down. It should be working your triceps in the back of your arms, but also it shouldn't have any pain in your back. So you're bracing that abdomen and keeping that neutral spine. Okay, hands facing the right way. Yep. Make sure your legs are 90 degrees. Maybe just bring your feet in a little bit. Yep. First up. And all the way down. And then how far you go down is also how far you feel comfortable as well. So if there's too much pain if you're going all the way down, just raise it up. how's that feeling? Can you feel it in the back of your arms?
Yeah.
Your triceps?
Yeah.
Bracing that abdomen, keeping that neutral spine, which is good. So how does that feel?
Good.
Feel comfortable?
Yeah.
Just give me 2 more. Excellent. That's good work. Okay, so that wraps up those exercises, the 4 of them. Like I said, we're not going to do the crunches because you've raised that issue with the lower back. But by certainly bracing your abdomen through all these other exercises, it will definitely help with securing that lower back, making it much stronger. Just remember, for all those exercises, they were 15 reps and 2 sets of those 15 reps, and you have that 60 seconds rest in between. With this training phase, we're looking at doing that 2 days per week, with 2 days rest sort of in between.
Okay.
No worries. Okay, Faye, now that we've finished our conditioning phase of the program, we're going to move on to the extended cool-down part of the program. Remembering that with having diabetes, we need to cool you down for that 10 to 15 minutes. What we're trying to do is slowly bringing your heart rate down from that exercise heart rate to that resting heart rate. So we're looking in terms of that around the 70% down to that 40% of your heart rate max. Once we've completed the cool down phase, we'll then move over to the stretching area. We'll go through a full static stretching exercising, which I'll show you. I'll go through those static stretches with you, and what that means is you'll be able to do those not only at the gym but also like at home, for instance, if you're doing exercises at home. What I'd like from you is maybe some feedback on the program that we've just gone through, the session. So I'd like to know whether your program is appropriate for your needs.
Yes.
They were?
Yeah.
Oh, that's excellent. And do you feel that the aims and objectives were met? Basically, that we found out about what goals you were after or wanted to achieve, and do you think the program met those goals?
Yes.
Yep. And lastly, do you think there's anything that we could improve on within the program or the session?
Not at this stage.
Yep. No worries. So what we'll be doing is monitoring your program for the next 6 to 8 weeks, and obviously if there's any changes or any changes you'd like to have throughout that, we can adapt the program and re-change it, so moving forward we can incorporate those changes if you need to. Okay?